I'm Social Free State. I'm a victim of the EU migrant rape crisis. My case is still open, so I have to remain anonymous, and I talk about my concerns regarding political correctness, how it enables crimes and how it also silences the victims of those crimes. And I'm going to talk about brain surgery because many of my subscribers will know that I underwent brain surgery the week after I was raped by the migrant. This was something which was pre-planned before and had nothing to do with the rape itself. So I'm going to discuss that. So I was born with this condition, although it wasn't recognised in me until I reached my teenage years. I had started having seizures. My parents had come into my room one night, hearing a lot of kerfuffle, and also seeing my legs twitching and shaking. And I was on the floor between the bed and the bedside table. So my face was blue, my lips were blue, and my eyes were rolled up into my head, and I was clinically dead by that time, and the paramedics were able to resuscitate me. And this happened a second time, on that occasion I got diagnosed with epilepsy, and then my furniture was rearranged so that I could, I would not be at risk of anything like that happening again. Now, when I was diagnosed, there were neurologists who were generalised neurologists, not specifically in the area of epilepsy. And I still find today that there are very few specialists in epilepsy, but I've been very lucky since to find a specialist in epilepsy. So, because I didn't have someone who was specialised in epilepsy, but was a generalised neurologist, because I wasn't reacting well and the drugs which I was put on weren't actually preventing any seizures, and the scans which I went through, the scans generally observe and note the area surface of the brain rather than the depths of the brain. That takes a different kind of scanner to achieve the depths of the brain on the effects inside of the brain. So there was never anything noticed in the scans, which I'll come back to because that's very relevant into my misdiagnosis. As for how it affected my life, well, employment was an issue and always has been an issue. There was a time when we didn't have to notify the employers that we did have epilepsy, but that's changed by law now, so I'm legally obliged to tell future employers that I do have epilepsy. And obviously by doing that, that means that the choice of jobs available to me are reduced significantly. And it also means that certain types of jobs I'm just not capable of doing as well. Any jobs with driving, and also from a legal point of view, I could be to some employers a walking case law in the future, and if I had a seizure on their premises and was to bring a case against them and sue them, employers don't really want to go down that route. So it is very difficult to find employment, but I deal with that by I became self-employed, and that worked out fine for me. So having dealt with the employment issue, then I got into relationships, and I was engaged, and me and my partner, we wanted to have a child and get married, children and get married. So we went to see the specialist or the consultant, the neurologist, to see how feasible it was for me to have children. And because of the generalised view of the neurologist and the inability to control my medication, the inability to control my seizures with medication, I was diagnosed with non-epileptic syndrome, which is a psychological form of epilepsy. It's sort of like a self-harm kind of epilepsy. So that was what I was diagnosed with, based on what the scans failed to provide, information that they failed to provide. So the neurologist has said to us that having children was absolutely okay, but not with regards to the medication which I was on at the time. So I had to be weaned off that medication and put on alternative medication. And that whole process took about a year to 18 months, I'd say. The reason why I couldn't take the other medication which I was on was because it caused deformities in a fetus. So it wasn't something which I could do. And obviously having children when you're an epileptic woman, it means that you have to make these decisions and plan the whole process. You know, it's all greatly planned. So I was put onto different medications, and I suppose why I wasn't put on those medications is because they were newer and they were also more expensive. So I suspect that there's chances that some epileptics are put on certain types of medication because it's cheaper. And we were told that we would be able to have children because it was non-epileptic, or it was considered back then with a misdiagnosis as non-epileptic syndrome, and that meant that the seizures would likely reduce due to the hormones of pregnancy. So we got pregnant and the seizures started to increase. In fact, they started to increase to the point where I was having a seizure every 20 minutes. Not necessarily a grand mal seizure, but definitely a seizure. More partial seizures, which of course can lead into grand mal seizures. And they were every 20 minutes during the pregnancy. And so myself and my partner, we questioned the diagnosis of non-epileptic syndrome, as we couldn't really understand why, when I wanted to have a child and family so much, was I trying to psychologically harm this baby inside of me. So, and also my partner, he threatened legal action. He threatened legal action against the hospital, against the doctors, against consultants, everybody. So they really got their act together when they had that legal threat, and they then referred me to an epilepsy specialist. And there's so few of them that I'm absolutely grateful that I have that specialist. So during my pregnancy, the seizures started to intensify, and I did start having grand mal seizures whereby I was falling headfirst onto my stomach, and my stomach was hitting all sorts of corners of furniture, and it was getting really quite concerning for us both. So we decided to talk to the hospital and talk to the doctors, and we decided that we were going to have an elective C-section at 37 weeks and give birth 3 weeks early. So we did that, and we had a lovely healthy baby boy who was a huge 8 pounds at 37 weeks. So had he have been full term, then he would have been the same weight as his dad and would have been a 10 or 11 pound baby. So ew. However, after having had my son, the seizures continued being just as intense as they had been previous during the pregnancy. And I think that might have been down to severe anxiety. I wasn't feeling depressed, but I was feeling incredibly anxious because I was so terrified. And I think that this is a normal new mother feeling, but I was so anxious that my little man was going to die. And I think that every mother feels that intense anxiety that such a little human being, you know, could just die, and you don't see their chest raising up and down when they're sleeping, and you have to touch their chest to see if it's moving, check that it's breathing, and their breathing is so quiet. And I didn't really get much sleep at all then, and with everything due to my epilepsy and the medication that I was on, I was incredibly anxious over his survival, basically, even though he was really healthy. As it happens, he's a very smart little boy, and he is very physically capable. He hasn't been harmed by by the medication in any way whatsoever, and yeah, he's done brilliantly. However, and also myself and my partner, we got some incredible advice from the doctors, and these new doctors who we'd been sent to and referred to, they were amazing and still continue to be absolutely outstanding in the help that they provide me. They are just incredible. The scans which had missed my tumour in the first place were redone by this new specialist hospital, and they found that there was a tumour in my brain. The tumour was just 2 millimetres wide, but it was 4 centimetres deep into my brain, and so it kept getting missed, and it probably grew deeper during pregnancy and after pregnancy with all those hormones rushing through my bloodstream and body. So there was an option given to me, because they found that they could provide surgery, and they said that if I had this surgery, then there was a high possibility that I would become seizure free. And this was important to us both because I was a new mum, he was out in work, I was on my own with my son. So we needed to ensure that this little newborn baby and this young toddler would be absolutely safe in his environment. So we both discussed it, and we decided that I should go through with the surgery, and that was a joint decision. It would inevitably mean that our little boy was safe and there were no problems for him. So with that comes lots of tests. So you have an intelligence test, you have a psychological test, you have a psychiatry test and a memory test. And these are just to check that you're an ideal candidate. So you need to be, quite square across the board and quite capable and able. If there's any problems with any of those areas, then you wouldn't be able to have surgery, basically. And because I was an ideal candidate, there was an 18-month wait, and that meant that that meant that I really didn't want to put off the brain surgery, because it was such a long wait, and it was so necessary with having a young child, a little baby basically. And due to lots of outside reasons, as well as the stress going on within this situation, I became a single parent, so surgery became even more necessary because of being on my own all of a sudden. And then obviously, as most of my listeners will know, I was raped the week before I had the surgery, and I didn't tell anyone. And I didn't tell anyone because I wanted to concentrate on the surgery, and I didn't want to put it off either, because it was so important to me to be able to look after my son properly and carefully. And before and during and after the surgery, during the recovery, my son lived with his dad for 3 months. So during the surgery, I will show a picture at the end of this, and my brain, I had lots of electrodes. Well, I had my skull, part of my skull removed. I had electrodes put into my brain, and I had to stay like that for several days while they monitored my seizure activity. And then once they'd located where they needed to remove the tumour from, I underwent brain surgery. So I never had that skull replaced until the end of the surgery. So during the surgery, there were some strange activities. Because you're awake during the surgery, you have to be awake so that you can tell the surgeon, you know, well, basically they need to check. They'll ask you strange questions, like to do sums during the surgery, or they'll ask you to wiggle your fingers one by one like that. And they will also ask you to wiggle your legs and your toes, just so that they're not taking any important bits of brain out in case you can't walk or something afterwards. So you're actually awake as your brain surgery is happening. And I was listening to the radio, and there was a piece on Cornish pasties, and after I came back out of surgery, I was desperate to have a Cornish pasty. It was on my mind all the time. So it's a very bizarre procedure which you are awake for. I remember the surgeon came over to me and he said, you know, is there anything that you want to ask me before you go through for the surgery? And I said, well, yes, I need to know that you woke up on the right side of bed this morning, because I was the first person he was operating on. And I said, I don't want you working on my brain when you're in a bad mood. And yeah, so I wasn't that scared, to be honest with you. I was looking forward to a new life rather than feeling afraid, and I felt very, very positive about the whole situation. And you'll probably see that in the picture which I provide at the end, because I wasn't scared at all, but I did fear that I might not see my son, but I wasn't fearful of the operation. So after surgery, I recovered very quickly. I was shuffling around on my feet after a few days, and I had asked to stop taking painkillers. You were given painkillers, but I don't like taking painkillers, so I was on paracetamol next, within a day, actually, the next day. And I was sent home after 3 days, which was one of their quickest recovery times ever. Yes. And I stayed at my parents', and there I had to learn to walk, use my hands for cutlery, and all these little things which we take for granted. I had a huge fear of heights, and I really struggled with stairs. I especially coming down. So many of the things which I was relearning, I was doing alongside my little toddler boy. So we were both coming down the stairs, both on our bottoms, sliding our way down, things like that. And that was fun, because we had little races to see who got to the bottom first, and there were accidents on both parts, especially when we were learning to run and things like that. It's something that not many parents do, I suppose, alongside their children. And then what else? Oh yeah, I've had psychological tests since, and obviously everything's fine. I have suffered with post-traumatic stress disorder since remembering, but the memory test proved that there was a significant decline after the surgery. The intelligence test also showed a significant decline afterwards, which I was really upset about, and I'm quite sort of paranoid about, because sometimes I find it really hard to articulate myself or recollect anything which happened. So that's really quite a frustrating situation, but it's okay. And now, well, I had been seizure-free. It had proven to be very successful. I had been seizure-free for 3 years, and I had learnt to drive. Since recalling the rape, I have been under a lot of stress, and I have been having seizures again, unfortunately, and they are not controlled. However, my son is older, still young, but he's very clever, he's very wise for his age, he's incredibly clever. And he's able to he knows how to deal with a situation if it arises when he's around. So he's a very brave little boy, and, you know, wonderful. I'm so glad that I'm so lucky to have him. And that's all really that's happened with my brain surgery, and what happened before and what's happened since, and where I'm up to now with it. Yeah, so I hope that fills in some information. I am going to be talking about it on my interview with Angry Foreigner, so there might be some details which you hadn't heard of, and I'm trying to fill you in. I didn't want to overwhelm everyone with how shitty my life is, because there's so many bits and pieces which just sort of seem like it's so unreal. But yeah, this is my life. Do, 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 do. That's just a tune from This Is Your Life. Anyway, if you'd like to carry on hearing different pieces of information, sometimes there'll be vlogs, sometimes they'll be about law, sometimes they'll be about politics, sometimes they'll be about history. I don't really know, so that's why this is a vlog. But please subscribe. Please follow me on Twitter, because I do provide a lot of information, and I do write a lot on my website, so you'll get updates from blogs on there or podcasts on there. And that's Social Free State, and my website is socialfreestate.com. And please share my stuff, and thank you very much. If you'd like to help out on Patreon, I'm on Patreon as well, and I really appreciate you listening. It helps. Thank you very much.